Hi everyone, welcome back to ID Rapid Reviews. Today we're covering a study published in the November 2025 issue of Clinical Infectious Diseases on CMV-specific cell-mediated immunity in a Phase 3 randomized trial of extended duration letermovir prophylaxis in CMV seropositive allogeneic transplant recipients. CMV seropositive allogeneic hematopoietic cell transplant recipients are at a high risk for CMV reactivation and disease, especially in the first 100 days, but also later if immune reconstitution is delayed. Letermovir prophylaxis through about day 100 substantially reduces early clinically significant CMV infection. But once prophylaxis stops, late CMV events still occur. A subsequent Phase 3 trial extended prophylaxis to about 200 days and showed a marked reduction in late clinically significant CMV infection, around 1% with extended duration letermovir versus 18% with standard duration. But after prophylaxis was stopped, CMV events rose, and by week 48, the cumulative incidence was about 13 and 19% with extended versus standard therapy, respectively, then plateaued, suggesting further extension may benefit some patients. This raised the question of whether duration should be individualized based on immune recovery rather than a fixed calendar period. CMV-specific cell-mediated immunity is critical for controlling viral replication after transplant. The conceptual model is that robust CMV-directed T-cell function should correlate with lower risk of clinically significant CMV infection. If we could reliably measure that immunity, we might tailor how long to continue prophylaxis rather than treating every high-risk patient for the same duration. QuantiFERON is a commercially available interferon gamma release assay that uses whole blood and measures CD8 T-cell responses to CMV peptides. It offers standardized cutoffs and short turnaround time. However, it captures only CD8 responses, omits CMV-specific CD4 T-cell responses, and relies on HLA-restricted epitopes. In this study, investigators used samples from a randomized, double-blind, placebo-controlled trial. Adult CMV seropositive allogeneic transplant recipients received letermovir through about day 100. Then high-risk patients were randomized to either continue prophylaxis or switch to placebo for another 100 days. All were monitored for clinically significant CMV infection through week 48. QuantiFERON CMV was performed at 3 pre-specified time points, around day 100, around day 200, and at week 48 post-transplant. The primary analysis included patients with results at all 3 time points to track immunity trends. For the trend analysis, 129 patients had complete QuantiFERON CMV data, 82 in the letermovir arm and 47 in the placebo arm. Demographics and transplant characteristics were similar between groups. At day 100, test positivity was low and nearly identical between groups, about 31% in each arm. By day 200, the trajectories diverged. In the group that had stopped prophylaxis at day 100 and received placebo, QuantiFERON CMV positivity rose to about 75%. In the group that stayed on the drug, positivity rose more modestly to about 49%. This suggests continued virologic suppression delays measurable CMV-specific CD8 responses. By week 48, after prophylaxis had been stopped in both groups, QuantiFERON CMV positivity converged, about 66% in the extended letermovir arm and about 75% in the standard duration arm. In other words, CMV-specific immunity caught up after therapy was discontinued. The investigators examined whether QuantiFERON CMV can predict who will develop clinically significant CMV infection after prophylaxis stops. In patients who completed about 100 days of letermovir, about 10% with a positive test result developed clinically significant CMV by week 48. Among those with a negative result, about 21% developed CMV. In the extended letermovir arm, clinically significant CMV occurred in about 10.5% with a positive test and about 19% with a negative test. So the pattern was essentially the same after 200 days of prophylaxis as after 100 days. From a test performance standpoint, treating a positive QuantiFERON CMV as protected, the positive predictive value probability of not developing clinically significant CMV given a positive test, was high, around 90%, but the negative predictive value, probability of developing CMV given a negative test, was low, about 20%. Overall, in this large, prospective, multi-center Phase 3 setting, neither a positive nor a negative result meaningfully altered the risk beyond what was already expected from a fixed prophylaxis strategy. Mechanistically, the limitations make sense according to the authors. Notably, QuantiFERON CMV detects interferon gamma release from CD8 T cells only, leaving out CMV-specific CD4 responses that are central to durable control. The authors conclude that extended letermovir postpones but does not prevent CMV immune reconstitution. QuantiFERON CMV positivity increases after prophylaxis stops, yet the assay sensitivity, specificity, and predictive values are not sufficient to guide decisions about when to discontinue letermovir. The full study can be found at CID, and a link is available in the video notes. Thank you for watching ID Rapid Reviews. Please like or subscribe to the channel and leave any constructive comments or feedback.